Voice therapy is typically done on people, clients who have seen an ENT doctor, and they will have a hoarse voice. There are those who whisper. There are those who have no voice. It was there and it's disappeared. So those are the people who would have voice therapy. So it's just a problem with the voice, how they speak. One of the conditions will be a hoarse voice. Somebody comes with a hoarse voice. Now, the ENT doctor actually checks what the cause of that hoarseness is. And it could be, some people have growths on their vocal cords, which would cause the hoarseness. Then there's some people whose vocal cords don't meet, and you need the vocal cords to meet for you to produce the voice. So that's how a speech therapist works with an ENT doctor. So the ENT doctor looks at the structure of the voice box and then sees what the problem is, and then they send the client to a speech therapist to work on the voice. And sometimes voice therapy actually clears it so that they don't have surgery. In voice therapy, first of all, what I start off with is what we call vocal hygiene. There are many people, because of their profession, tend to abuse their voice. These are politicians, teachers, preachers, and you and I, we go to a game, rugby, and we're yelling. That's voice abuse. So typically I will have to start with vocal hygiene, which is basically hydrate. You need to drink water, and please drink room temperature water. And then voice rest. Some people just have to rest their voices. And then now, depending on the condition, there are different exercises that will help. Either help you get your vocal cords to close or meet, or for that one who is overdoing it, you relax so that you don't overdo it. So it will depend. Each case is different. But for everyone, vocal hygiene is what we start off with. There's actually speech therapy, voice therapy, language. So actually speech and language typically work together. Voice is just voice. Your voice, whether it's high, low, that's voice. So, and then the voice therapy will just work on the voice. Speech is your sounds. How do you get your sounds together? Then language is your vocabulary. So they're under the same roof, but they're specific. We have specific things to work on. your child has a problem when 2.5, they have less than 50 words, 50 different words. Then we have children who speak, yes, but they do not articulate their words well. So that will be what we call articulation disorder or difference. For example, instead of a child saying cat, they'll say tat. So they're putting a T instead of the K sound. So that child needs therapy to help them get over that. Your child will have a problem if, yes, they speak, they have the words, but they do not really understand instructions, simple instructions. Then they may not be able to repeat words. So that is what we call phonology. So you tell them banana and it comes out in a totally different way. That is, we need to work with them because the way they hear the sounds in the word is a little off. So they just need a little help with that. Typically those will be under auditory processing. Yes, they can hear, but they do not hear the sounds well in the words. When your child at 3.5 years is stammering, we need to see them for therapy. Some of it is developmental stammering that should disappear by the age of 4. But if it's still persisting, then that's a stammerer, and there are ways to work with the child. When a child has trouble learning the alphabet or numbers, then we need to see them because that's an indication of dyslexia. And then for the older children, when they're having trouble reading and writing, then they also need therapy. The reason I brought that, I talk about that, it's very common where you find a child speaks and everybody thinks everything is okay. Yet you start noticing the differences when it's school time, when it's time to go at age 6 or 7. Yet by the age of 3 and 4, we could have helped. And out of all this, early intervention is the best time. So if you as a parent have a question mark, please come and see us. It could be nothing, it could be something, but we can help sort it out.